computer.
Hello, I'm Madeleine Kingsley, and this is another Cancer Active video for the forum. The idea is to glean from Chris Woollams, who I'm with today, to get information and tips for what people might do for their cancer. Today we're talking about brain cancer.
Hello.
Chris, hello.
Hello.
Would you like to...
Brain cancer, my number one subject. My number one subject. Yeah. Been on it for 21 years.
So 21 years is a long time. What do you think has changed in this field, and how can people feel good about the progress that's been made?
That's a really good question. Do you know, I don't think a lot has changed. I'm not negative about it all. I think there are huge problems in the whole idea of brain tumor. But basically, have we got new drugs? No, not really. Have we got new methodology of treatment? No, not really. At the moment, there is some coming. But I think it's almost like it was in Catherine's day. I mean, you know, Catherine was given 5 months, lived almost 4 years. I think now I know more. I could have made her live longer, if you see what I mean. But she didn't want to change her lifestyle. She didn't want to. I'll do anything you want, Dad, but I don't want to change my lifestyle. It was one of those. But it still comes down to when you get a brain tumor, you've got to make the running. It's, you've got the brain tumor. They haven't got much weaponry. So you need to do a number of things to help yourself. And when you look, as we'll come to, when you look at some of the people who've beaten their brain tumors, like Ben Woollams, the professor in San Diego, he did the drugs, but he built a whole program of off-label drugs around the outside, and he did the diet, and he did supplements, and he did exercise. You look at Amy, who you interviewed, Dr. Henry Friedman about 10, 12 years ago, who's the number one in America. And Amy had the brain tumor the same time as Catherine, and all the drugs failed. So he gave her dendritic cell therapy. Yes, that is still coming, and it is a possibility. It's nearer now than it's ever been. And but she used, I think, 23 supplements and built a diet and exercise program. So I think the bottom line of what you're saying is not a lot has changed. And on the orthodox front at the moment, but a lot has changed in our knowledge on the complementary front. So we have more weaponry and we know more things that work now.
Of course, that means getting the message out to more people that they can be in charge of this condition rather than just leave it to the experts totally and just be in the hands of professionals.
Well, you get two groups of thought. It's quite incredible, really. So I build a program for somebody, let's say at one hospital, and they're told, no, you can't take any supplements. And yet I've just had a lady and her daughter, and the daughter's gone to Royal Marsden and said, can I take these 10? She's going through chemo and radio at the moment, the first round of treatment. And the Royal Marsden agreed every one of the supplements. So it's not our problem. It becomes our problem. The problem lies in the oncologists, who unfortunately, I'm not being critical, they don't have time to read. Let's be nice to them. They don't have time to read. If they read, they know that some of these supplements can make a huge difference.
So what do you think could happen in order that they do get this information and they become a little more open-minded about adding more to their armory?
What, the oncologists?
Yes.
I'm afraid it all comes from the top. So it all comes from NICE, who pay for drugs in Britain. So NICE may approve something, may not approve something. It then comes from whoever runs the oncologists in Britain, BMA, I would guess. And I think increasingly doctors, oncologists are being pushed into almost being, I call them Radio 1 disc jockeys. They've got a playlist of 12 things they're allowed to do. If they step outside it, they could get told off. So what can we do? We can try and encourage them and tell them there are things, but usually it's greeted, if I talk about diet, exercise, the two biggest things that increase survival times in people, everybody. We've got loads of research on diet. We've got loads of research on exercise. It's crazy. And yet you still get oncologists. I did the Children with Cancer conference, as you know, and still get oncologists who say there's no research on all this.
Do you ever get oncologists ringing you up and talking to you personally because they've seen great results from a personal prescription?
Again, that is completely divided. So I had a lady go to an oncologist in London, and he switched a few things around. It was for a second opinion. And he said to her, "What else are you on?" And she said, "I'm on artemisinin, I'm on berberine." He said, "Who are you with?" And she said, "I'm with Chris Woollams." He went, "Oh, I don't need to know anymore. He builds great programs." Right. So
Perfect.
I have some people who do that. But on the other hand, I've just had, I could name her Maisie. Maisie's 80 something, and she had cancer all over her. So it's not a brain tumor. Okay. And I said, "Oh, I see you've had carboplatin." "Oh, I hated it. I lasted a week." "Oh, I see you had Taxol." "Oh, I lasted 2 weeks." "I see you had immunotherapy." "I lasted 2 months," but she hated it. And afterwards, her daughter rings me up and says, "Mum likes you, so she's going to do your program." So we do the program, and this is from April of last year, true story, till April of this year. And she goes in for a scan, and the oncologist is not there. So the radiologist does the scan. He says, "This is fantastic. Everything in the top half of the body is gone, and all the tumors in the bottom half of the body are smaller." And literally, they've just sent me the latest scan. She's got one left in her liver. But what happened was the radiologist said, "It's all clearly working. Stay on the drugs. Let's just keep you there. You know, it's wonderful." And they said, "We're not on any drugs. We haven't done any drugs for a year." And so the oncologist wrote to them, they have this wonderful sort of, they're writing to a man in the clouds. They're not really writing to you, the patient. They're not really writing to me. So it was like, I understand that you're using some unorthodox medicines from an internet. I think he wanted to say quack, but he didn't. But they don't understand. They don't want to understand. They're not allowed to use the same treatment. So bingo. Where I get most upset is they don't think to worry about what caused it. It's just not in the repertoire. What caused this cancer?
So if one big issue is about communicating these ideas of looking for different medicines, different natural, the stuff that you're prescribing, is the next thing that people actually don't care, the doctors don't care to look beyond this? What is the real problem with moving forward?
You're going to get me locked up. No, I think there are some things they just don't know about. So Jeff Boycott had a parasite. You know this, and I know this. And so in the middle of his treatment, if you like, I built it all on the phone. It was the first person I ever built on the phone in Buckingham. And I said, this is a really weird place to get a tumor on the back of your tongue like that. It's a lump. They were going to go in, break his jaw, go in, cut the tumor out, and give him chemo and radio. And one guy said he got 12 weeks to live, and the other guy said he'd never talk on television again. And this is all in his show. It's on the community shows. And I suddenly said to him, "Do you know what? This is really weird." I said, "When normally it's a sore, it's not a lump." I said, "When you were in Bangladesh, Pakistan, Sri Lanka, did you ever get the runs?" It was my little joke. And he said, "All the bloody time." I said, "You got a parasite." We killed his parasite. And he says to people, he says, "When I went into Leeds Royal Infirmary 8 weeks later, they were bloody embarrassed." He had a cancer, but he had a parasite. And parasite's not even on the playlist for oncologists. I'm not criticizing him. I'm just saying it's not on their playlist. They're into treatments. You get a cancer in your breast, they will treat that cancer in the breast. It goes to your bones, they will treat it in the bones. It's called radiotherapy. It goes somewhere else, they will give you something for that. The liver will give you drugs. I call it chase the cancer. It's not what I do. I don't do that at all. Me, I want, you built a body. Anybody with a brain tumor, you built a body, whether you like it or not. You built a body conducive to cancer. It's never one thing. It's half a dozen things that cause it. And what usually happens is about 18 months before you get the cancer, something tips you over the edge. It can be antibiotics at one end. It can be high emotional stress at the other. I had 3 ladies who'd lost their mum. Mum lived around the corner. And so it was huge amount of emotional stress. Cancer research says stress has got nothing to do with cancer. So that can tip you over the edge. And what I do, I know what I do. I build you the body you should have had it in the first place. and I build you a program, because one thing didn't cause it and one thing's not going to fix it. In fact, when you interviewed Henry Friedman in America, he made a really fantastic comment. He said that it is completely naive to believe that any one drug could ever cure a cancer, let alone one as dangerous as a GBM. I totally agree with that. That's why I build programs. It's never one thing, and nor can the solution be one thing. You have to shut down all the doors.
Well, you've been saying from the start that it's a domino effect, that it's not one cause, it's a multiple cause. So is one of the biggest issues in cancer treatment still that people don't think holistically, that we have to actually accept that this is a whole body disease and not just a one organ disease?
We are being left behind by the Americans. And we are being left behind because now in places like UCLA, they have integrated medicine degrees. We don't. And if, I don't know, Julian Kenyon at the Dove starts to try and tell people in writing that he treats cancer, he'll be kicked out. He's not allowed to do that. He's not allowed to, for one moment, to say he treats cancer. Technically, every hospital where it's a cancer ward, all the doctors in there are breaking the law. I mean, it's a nutty society, us with cancer. But in America, my breast cancer lady, we got it all cracked, and some oncologist said to her, okay, it's wonderful. I want to tell you now, you've only got a 3% chance of getting this cancer back in the next 10 years. What happened? She panicked. And she went to Nevada and had loads of treatments in Nevada with an integrated clinic. Yeah, and it's there. It's an integrated cancer clinic. You know it is. But we don't do that. We don't have integrated cancer. Can you get a degree in Britain in complementary therapy?
Maybe the new King Charles will bring that in. Maybe we'll see some more further developments of that.
Maybe.
But are there? How can you deal with the various issues that that you say cause cancer? These multifactorial issues. So, for example, blood sugar levels, infection. What would you like to say about that, both in terms of prevention and early treatment?
All right. I think there's two issues here. I think the first issue is, why are brain tumors so hard to treat? And people need to understand this. First of all, there are lots of different types. So you can get a glioblastoma, you get an astrocytoma. They don't even now think astrocytomas become glioblastomas. You can get a medulloblastoma and all this sort of thing. So you get lots of different types. I think secondly, at the heart of a brain tumor are stem cells. And stem cells in any tumor cannot be killed by conventional chemotherapy. So they don't really know of any drugs that can kill cancer stem cells. And the worst cancer for stem cells is pancreatic, followed shortly behind it by brain tumors and prostate cancer. So stem cells, how do you kill those off? Well, you can't. And so it always stands the risk of regrowing. You can do it naturally. Okay, you can kill them off naturally.
How do you do that?
Okay, well, I'll come to it. But I think the other things are that it's very hard to develop a drug because they've got to cross the blood-brain barrier. So that limits them straight away. And the blood-brain barrier isn't some envelope right around the brain. It's around every cell. So it's very hard to develop drugs. And I think the other thing is, people don't realize when you get a GBM, you're stage 4, grade 4. Now, it's advanced. Astrocytomas might be stage 1 or stage 2, but it's usually advanced. Now, that's like a lady coming to me with breast cancer. You know, I get them quite often, and they've got lumps in their breasts, but they've also got it in their liver, their lungs, and so on. It's all over them.
Right. Yes.
And the problem is, in the way oncologists work, if you're stage 1 or stage 2, you got a big lump in your breast or maybe 2 lumps, that's stage 1 or stage 2. By the time it goes outside and it's in the lymph, it's stage 3. And if it's in the liver or another organ, it's stage 4. They think they can treat you at stage 1 and stage 2, but after that, they're trying to give you longer life. And I'm sadly concerned that their whole approach to GBM is, let's get you to live 1 year and 6 months rather than 1 year and 3 months. Now, again, you might not know this, but I had a lady come to me about breast cancer, I think it was about a year ago. And I said to her, how did you find me? And she said, oh, Sarah Zoza. I can't remember the name. And I said, that's funny, I remember that name. And she said, yes, you did. You did her PP for her while you were sitting at Gatwick Airport. And I said, I know exactly who it was. And I tell you what, she's got a GBM. So I built her program for her, I kid you not, in about 2004-05, when I was sitting at Gatwick Airport. We couldn't find time to do it. So I did it on my phone. And the reason I know she got GBM, I kept saying, put your bloody phone down. I mean, literally, you do not want, if you've got brain tumor, you don't want to have a phone anywhere near your head. You want to keep away from Wi-Fi and all that sort of thing. It really does affect it. So, I built the program. She's alive, kicking and well today.
Well, that's wonderful.
So, you know, people have got to understand, I'm not saying we can cure all brain tumors or anything like that, but we can have a go. And some of the, you know, results and that people get from the things that, you know, when you build a program, you know, you find people are alive 8, 9, 10 years afterwards and so on. And I think you just got to keep yourself going. I mean, the most important thing really is people who get a brain tumor have got to be determined. I always say, I had someone yesterday, I say, look, my job's to be boringly thorough, your job's to be determined, and your husband's job is to be positive. That's how the team works. I get really angry. I get really angry when patients go into hospitals and the nurse says, now, be positive, dear. And you think, no, tell them it's their job to be positive. Your job, you can't be positive. You're going, you know, like I had one lady on the bus in Wigan to radiotherapy every day. How can you be positive when it's pouring rain? You can't.
And you're on the path to have terribly difficult treatment. That's not much good, is it?
Yeah, no. So, I mean, I think you asked a question about what do I think are the two biggest drivers, or whatever, you paraphrase what you said.
Infection and sugar, high sugar levels.
Yeah, well, there are two big drivers, actually. And I always tell people with brain tumors this right up front. And I say, look, you've got to understand that sugar poisons the brain. So I'm not talking about cancer, I'm talking about sugar poisons the brain. Now, we know that for a fact, because we know kids who get epilepsy, they can have 20 fits a day. Take the sugar away from them, and they have 1 fit every 3 weeks. We've now got research on adults. Exactly the same thing happens. We've got research on dementia. People with higher blood sugar levels get more dementia. So sugar is a poisoner of the brain. Now, what you also have in your brain is you have a pool of glutamate. So when I talked to Thomas Seyfried, he's the ketogenic diet champion of the world, professor at Boston College, we spent 3.5 days together, basically, or a couple of days together in the 3.5 day conference. And we were talking about glutamate, because he doesn't want you eating glutamine, which is an animal protein. And glutamine is more in animal protein than plant protein. And glutamine, he thinks, is a problem. And I said to him, well, and this didn't cause a falling out, but I have written about this. Glutamine is an amino acid in protein. And actually, what the real problem is glutamate. So it sounds like I'm splitting hairs, but I'm not. And glutamine converts to glutamate. So you have this reserve tank of fuel in your brain. It's called glutamate. So if you starve your brain of sugar, it can turn to glutamate. And we know, because again, prostate cancer is run by glutamate. And we know that things like lycopene block an enzyme called glutaminase, and that means you make less glutamate. And glutamate is also the store of excess sugar, and a little bit comes from folic acid. So glutamate is a problem. And people come to me and they say, I say, what's your cancer? They say it's non-methylating IDH wild type. And no one's told them what that means. IDH wild type means you've got the normal IDH gene. Well, you haven't got any mutations in your genes, by the way, in your DNA. No one's got any. There are no new mutations.
Oh.
Okay. Just Christine Mayer of Sloan Kettering last year proved it. I've been saying it for 50 years since I was at Oxford. Anyway, what happens is, if you're IDH mutant, then I think it's Pablo Kelly I was talking to at the show, and Pablo Kelly beat his brain tumor. your brain can't use glutamate. You're halfway home and dry. So if you use the ketogenic diet, all you've got to do is shut off the sugar. And
let's talk about that.
You're starving the tumor. So,
but that's, do we have to then go as extreme as somebody like Andrew Scarborough, who is eating insects for his protein? Do we have to be that extreme in order to starve the sugar and to be ketogenic? And do we have to fast for 16 to 18 hours a day?
I'm going to say this up front because someone on one show thought I was having a go at him. I'm not. I love Andrew Scarborough. I think he did wonders for people with brain tumors, right? And he tells the story, as you know, we interviewed him. You interviewed him. And he tells the story that he found out about the ketogenic diet, and the only fat to hand was whipped cream in the kitchen. And he squirted it down his throat to get onto a ketogenic diet. But then he actually wrote he's got a website, and he's got Beating Brain Cancer. It's a Facebook group and so on. But he launched his page on the internet, and his headline was eat meat, drink water. And halfway down the page, he said, lamb is your friend. And I actually wrote to him or sent him a message or something saying, that's not a ketogenic diet. That's an Atkins diet.
Or paleo diet.
And well, okay, hang on. But you see, Seyfried, when I told him that story, was in panic because he's told everybody to cut glutamine. And here's Andrew Scarborough saying, no, eat lots of meat and what have you. But what Andrew Scarborough is doing, even if it's the Atkins diet, even if it's a paleo diet, he's just getting rid of all his sugar consumption. That's what he's doing. And that's what you've got to do. That's part one. That's part one of this. And, you know, we'll come on to talk about this. But the problem is they will give you temozolomide. They'll give you radiotherapy. They'll give you dexamethasone. Guess what? Temozolomide puts your brain sugar up. Actually, there's a very good argument the radiotherapy affects it. The stress of all those treatments put your blood sugar up. And dexamethasone is awful at putting your blood sugar up. It really does it. So you need to get off it as fast as you can. Prednisolone is safer. It might not be as good for reducing the brain as dexamethasone, but prednisolone doesn't put your blood sugar up. So we would always, if someone came to me, I wag my finger. So if someone's got a brain tumor or colorectal cancer, I wag my finger and I say, you've got to understand that one molecule of sugar is your enemy. Because if you have too much sugar, it just makes glutamate as well. So one molecule of sugar is your enemy. Now, I only do it with those two cancers. I wouldn't do it with breast cancer or prostate or anything else. But, you know, sugar's a problem, but it's not as big a problem. Leukemia is the next one. Leukemia actually robs its healthy neighbors of sugar to grow. So sugar is a big problem. And we have research. Of course we have research. I'm a researcher. We have research that berberine makes temozolomide work better. It's not just it cuts your blood sugar down to below 4. It makes temozolomide work better. And we have research that says metformin makes temozolomide work longer. I ought to explain to people what happens is if you're newly diagnosed and you have a brain tumor, they are going to give you temozolomide for 6 weeks and a daily dose of radiotherapy. Then they'll probably give you 4 or 6 weeks off to recover. And then they'll give you probably 6 months worth of temozolomide. Okay, so that's the background to it. So I would immediately, with the chemo and the radio, that in that session say, I think you should go for hyperbaric oxygen. It makes chemo and radio work much, much better. It makes the ketogenic diet work much, much better. And I'll put people on berberine as a very minimum, if not metformin. Take 3 lots of 500 milligrams a day of berberine. However, I am not advocating the ketogenic diet. I'm just saying how it works. If I used the ketogenic diet, it would be on people with brain tumors, and it certainly would people on who are IDH1 mutant.
But you are now beginning to talk about another very important area, which is off-label drugs and repurposed drugs.
Okay. I am. But I said there were, I'd just like to finish this. I said there were 2 big issues up front. And sugar is one of them. And the other one people have got to understand, which again is not really on the doctor's radar, is infection.
Do you include parasites in that?
Everything.
Okay.
And so what we know about infection is that when you get infection, especially if you get a parasite, it changes the whole nature of the microbiome in your gut, and parasites could dominate the gut. And we know, because there's research, that you have a gut-brain axis. So anything that happens in the gut has an effect in the brain. And we know, for example, that they've shown that a loss of bugs, sorry, I'm a biochemist, we call them all bugs, that a loss of the bugs that make anti-inflammatory molecules is a real problem in brain tumors, because those anti-inflammatory molecules via the blood system or via the vagus nerve impinge upon your astrocytes. And if you don't have the anti-inflammatory molecules, your astrocytes become more inflamed. Now, I have no idea what this is, but I can guess. I think it's something called butyrate. Butyrate is made by a bunch of bugs called ruminococci, and it's made because you eat lots of soluble fiber. And so you make more ruminococci and you make more butyrate, and butyrate actually heals the gut wall. It gets across the gut wall. It goes into the bloodstream. It also goes across this blood-brain barrier. It's highly anti-inflammatory. Maybe it's that. I don't know. But then you come on to some things we do know. So one of the doctors, oncologists in America was given 5 brains to play around with, and he found Borrelia burgdorferi in every single one. Lyme disease.
Really?
So if you get Lyme disease in your body, it lays waste to you. You're absolutely tired out, etc., etc. But seemingly in these people, it doesn't have a lot of effect. And the first 2 people I had after this finding was that they both went and got tested. I'm not too sure how. I think bioresonance, and they both had Borrelia in the brains. Now I'm going to tell you that this is what happened with Catherine. Why am I so interested in this area? Catherine, at the 11th hour, 59th minute, I went to the doctors and said, can I have your tests? Look, we're really on the same side. Can I have your blood tests? They went, what, you mean the white cells and the red cells? I said, no, I want to know what's going on inside her. And they said, oh, we don't do tests like that. So here's your best patient ever. No one's lived more than 18 months, 20 years ago. She's lived nearly 4 years, and you haven't got any tests on her. Well done, guys. Well done. And so I took her off to Harley Street and had loads of tests done. And they found that some drugs called PCV, which are used sometimes, which are dreadful on the gut and so on, had knocked out all her natural killer cells. But also, so she'd never beaten the cancer at that point anyway. But secondly, she had bad yeast in her brain, and she also had a parasite or probably a virus.
And that had come from the gut?
Yeah. Well, you don't just get it in one area. It goes right through the body. You have a gut-lung axis, a gut-brain axis, a gut-skin axis. All these things are affected by the gut. If you screw your gut up, if you give your baby antibiotics before the age of 3, they're 8 times more likely to get an allergy by the time they're 8 years old. Okay, that's the lungs.
Well, I suppose, therefore, I am at least relieved that my grandson hasn't had a single speck of sugar approaching 2 years, not one.
Yeah, but
is that good?
We're on the subject of parasites. I'm just telling you that parasites from anywhere can change the whole microbiome. And there are 2 other things with brain tumors.
How do people get parasites? We know about Lyme disease, and we know about tick.
I had a lady, she was 32 years old in Essex, and I said to her, humour me, take a parasite killer. And she was, no, she'd never been outside Essex. And she took a parasite killer, and the listeners do not have to do this, by the way. She sent me pictures. And I kid you not, it was worms, worms, and more worms. There's just, the whole picture was full of worms, except for 3 or 4 almost ghostly grey-like things there, which looked like it should have been on Ghostbusters. Weird. She'd never been outside Essex. So I think, well, I did a speech at a cancer prevention conference in the morning and said 70% of people have got a parasite. And every doctor laughed in the room. And in the afternoon, Angus Dalgleish stood up, Professor at St George's, and said 70% of people have got a parasite. I mean, yeasts are parasites. You know, Borrelia burgdorferi is a parasite. So it doesn't have to be a wiggly worm. It can be, you know, something that causes a problem, just puts you down. And that's the other thing. There are 2 other things. So, and one is terribly relevant to Catherine. So, also found in brain tumors in high levels, Toxoplasma gondii. Toxoplasma gondii is cats. It's in the soil, it's in the earth, it's in water, but cats have Toxoplasma gondii, which is why pregnant women are told not to go near a litter tray and things like this. Yes. Well, first of all, they found it in higher levels in brain tumours. And then about 3 years ago, they did a study and they showed that when cats want to catch that mouse over there in the garden, they wee on the wall. And the mouse comes back and sniffs the wee. Excuse me, gut listeners. But what happens is the mouse takes on board the Toxoplasma gondii, and would you believe it goes to its brain? And the mouse goes around in ever-decreasing circles, and the cat can catch it. And then they did another study and showed that Toxoplasma gondii can affect your astrocytes in brain tumours. Okay, we're building a picture now. And finally, in high levels in glioma cells, for example, or astrocyte, what you've got is cytomegalovirus. Now, cytomegalovirus is in high levels in
CMV.
CMV. Yes, it's in high levels in us all. But they then did a study using a drug whose name I can never remember, Valsite, and they did a study using Avastin. Now, I'm sorry, I'm going to offend the Americans. On one at the moment about Americans, but basically, Avastin doesn't work. So what happened was they were using it with brain tumors in America, and the FDA said you've got to do proper clinical trials, and so they used Avastin in clinical trials, and you got no survival whatsoever. And somehow it stayed on the market for brain tumors because they researched 46 people who all said, "Oh, I feel much better if I take it," which I'm not too sure is a great criteria for a drug, but never mind. And so they then they did 2 studies, and they put Avastin with Valsite. And would you believe suddenly everybody was living like 10 months, a year. And secondly, they did Valsite on its own. And then they all lived like 18 months longer. And this is all, you can find all this on PubMed. It's all recent in the last 5 years. So Valsite is known to kill Toxoplasma gondii, but we have other things we can kill it with. So all I'm really saying is, it's just such a shame that your normal oncologist doesn't approach it the same way I do, because I could retire tomorrow if they did, because they need to stop all the sugar going into that poor person with brain tumor, and they need to actually say, well, what could he have actually causing this in the first place? And clearly, I'm not saying that cytomegalovirus causes it, because we've got no proof of that yet. But it's certainly in those cells, and if you knock it out, the cells become freer. The microenvironment of the cell becomes freer, and you live longer. But that's what cancer is. Cancer is a problem in the microenvironment of the cell. Watch David Lai. No, not David Lai. William Lai on YouTube. William Lai is he's a doctor, and he's invented 8 drugs on angiogenesis. And someone said, "You've got to go and watch him, Chris." And I said, "All right, why? What am I going to learn?" They said, no, he's you 15 years ago. And he talks about the microenvironment of cells, how you pollute your cells, how you can clean them up with melatonin and glutathione, and why cancers are reversible. That's what I believe. But you got to go about it the right way. That's what worries me.
Of course, there's one other very big difference between what you do and what the cancer oncologists do, and that is that they have, as you say, one way of treating everybody, but you believe in personalized medicine.
Yeah, I mean, you get 2 people come to me, I'm going to do something completely different. Equally, someone might come to me starting out with a brain tumor, or someone might come to me with astrocytoma. We've got, I don't know, a dozen people who've had astrocytomas we've held for about 5 or 6 years. They've got no worse. That almost is my start point. I want to get it under control. But I get other people, especially in America, come to me and they've had their tumor for 4 years, and the doctor's gone, I've got nothing more to, what and they come to me saying, what else is there?
Well, that, of course, is really important. And can you tell them not only what is there, but what might come? I mean, immunotherapy, other potential.
Okay. Well,
Can
what is there? What is there? We'll do what is there, and we'll do what else is there. Okay. What is there? They use temozolomide. Temozolomide is a 1986 drug. It was approved for cancers that are methylating. Catherine wasn't methylating. She had one round, made her very, very ill. There was no point in carrying on. And 80% of people are not methylating, but they still use it. As I said, they don't have much weaponry. So they still use it, and they use it in the first round of 6 weeks with radiotherapy, because radiotherapy does have an effect. So you have the surgery, and the radiotherapy is attempting to mop up the other cells around the outside. Okay, we know that berberine and metformin make temozolomide work better. We know that lomustine, which is the, wait for this, it's the, in PCV, it's the P, I think. No, it might be the C. I can't remember. Why do doctors do this? But it's the C, I think, in PCV. Lomustine, they've just done the second phase of a 3-part clinical trial. Lomustine makes temozolomide work better and longer. We know mefloquine makes it work longer. So there are other things that make it work, but the big thing that makes it work longer is the Optune system. It's a little skull cap, and it basically puts frequencies into your brain, makes temozolomide much better. It's very common in America. You rent it in America, and one of my patients has just had his oncologist in London apply for it. But I think by British standards, it's very expensive. But the research shows like 46% increased survival. Optune, the Optune system. So there are things that make your current drugs work better. If someone came near me for radiotherapy, I would have gone for proton beam. I don't like the idea of someone shooting a beam into me that goes straight through my head. Unfortunately, Carol Sikora and the Rutherford group, they've had to shut all their proton beam therapies. It's highly political. You know, they're units. They have 3 units in Britain.
Yes, they did. What's happened to them?
They've all shut. No one's using them. Oncologists prefer to use radiotherapy. I don't even want to go there. We'll get thrown off YouTube again. Not my 3rd yellow card and a red card, please. We can comment on that. So we don't have proton beam anyway. But you know, when I wrote it all up, Cancer Research, you know, had a real go at me saying there's no research on proton beam. Well, hang on, MD Anderson invented it in 2006. And when I wrote it all up, they've done 15,000 treatments of kids with brain tumors.
Yep.
So don't tell me it's got no research.
But we must have spent a fortune putting these proton beam.
Well, it was private. It was you know, Carol Sikora is chief exec of the Rutherford Group, and so I think the NHS, which promised to build 3 by 2022 and has built none, I think they're probably going to come along and try and buy them on the cheap. So I mean, that's the sort of the things you've got. So you've got PCV as well. That's another drug. I wouldn't go near it unless you were totally protecting yourself around the outside. But we'll come to immunotherapy in a minute. But the other thing is we are looking more and more at America, who are saying, what do we do about the 80% where temozolomide doesn't work? And I've had patients who were given selinexor, and I've had people who were given, and I'm going to have to read it because I cannot say it. It's dihydrogalacticol. It's on my website. Okay. And we'll put it on this. We'll put this on this show. So they are looking at non-methylating cancers, and they ought to, because it's 80% of brain tumors.
What you just said. Let me just that 80% of people it doesn't work with temozolomide. Is that what you said?
Yes.
It only works for 20% of people.
Yes.
I see.
But they say it's the gold standard, and they say things like, but we find it does work. Now, what happens if you take berberine and metformin? There is some research that seems to suggest you can convert the 20% into 40%. I'm being absolutely truthful now. I'm not saying it it cures you or anything. I'm just saying there is some research that seems to suggest that if you take berberine and or metformin, you can actually extend the number of people that temozolomide could work for. And the FDA turned this drug down. And they said when whoever it was, the drug company, actually went along and said, no, you don't understand how it works. Works really well against people who are methylating. The FDA said, okay, fine. Well, you can't get approval unless you have a test to do that. Well, there was no test in Catherine's day. Catherine, 2002. And so what's that? 16 years after it was put on the market. Okay, now there's a test. So what else?
What about immunotherapy? Have we got there yet?
I don't know. I think that was a question people asked, wasn't it? Immunotherapy is a funny one. So it's a very broad subject. And what happens is when you have a brain tumor, they whip the tumor out as fast as possible. Otherwise, it's going to press on the cranium and you're going to get headaches and so on. But some people, of course, can't have that. Their tumor's right in the middle. So they did some clinical trials with pembrolizumab, Keytruda. And they showed it didn't work with people who'd had brain tumor operations. But then some bright spark in America said, well, maybe if they haven't had a brain tumor operation, would it work? And lo and behold, it did. So people who've got 90% or I don't know what the figure is, 60% plus of a brain tumor can have a PD-1 like pembrolizumab or nivolumab immunotherapy drug.
How's it delivered?
I'm not a doctor. You can't ask me questions like that. I don't know. Probably comes DHL into the hospital, or maybe Amazon.
No. Don't give me that. Seriously, is it done by in the plasma, or is it done by?
I think immunotherapies are IV, aren't they?
Mostly, but what about? Isn't there a form of gel that you can put in? I've heard is being developed.
This is quite an old-fashioned idea. So in Catherine's day, they were using a drug called carmustine, I think, with a wafer, and they would give you the operation. They would put the wafer, and then they put the drug on top of it and seal you up. But as I said to you earlier on, the blood-brain barrier isn't a bag around the whole brain; it's on every cell. So if that drug isn't going to get through, there's a guy called Walsh at Royal Marsden who's really trying with one of my patients who's got astrocytoma, and he's been using lately carboplatin and Taxol, and it seems to be doing a job. But I always thought carboplatin couldn't get across the blood-brain barrier. So I don't know. They know more than me on things like drugs. I try and keep clear. My mum wanted me to be a doctor. I'd have been a terrible doctor. I belong to the "you're not ill, get up and get back to work" brigade. So I would have been terrible. What else? Off-label drugs you mentioned. So there is a drug called mebendazole. It has research with brain tumors, all done by Johns Hopkins, and it actually blocks tubulin, which is in worms. It's a helmintic or anti-helmintic, and it blocks tubulin, which is in microtubules, and you get lots of microtubules in brain tumors. And would you believe there's a drug called vincristine, part of PCV, which has got pretty bad side effects as far as I can see, and mebendazole has none of those. So you can use mebendazole with temozolomide or in its own, and you could use lomustine, but it's not approved in Britain yet because it hasn't done its third stage of clinical trial. What else? Just really what I was saying. We would look at things like melatonin. We would always use melatonin with brain tumors because there seems to be a very slight estrogenic factor in brain tumors, and melatonin regulates your estrogen, regulates your growth hormone. It's got 5 actions against cancer cells. So melatonin is a pretty good thing to use. So we would do that. Now, you asked about off-label drugs. Okay, so one of the first people I ever noticed in all this was Professor Ben Woollams. He's in San Diego, and he got a brain tumor aged 50. not the brain tumor wasn't his. He was age 50, and what happened was he said, right, I'm going alternative, and all his doctor friends, he was a professor of psychology, all his doctor friends said, no, alternative doesn't work. You need to have the drugs. And he spent 3 months researching it and then said, all right, I'm going to have the drugs, but what I'm going to do is I'm going to have whatever it was, drug number 1 and drug number 2 rotated. I'm going to have lots of drugs. And he said, and then I'm going to build an off-label drugs protocol around the outside. And it depends on the report, but he used mebendazole, he used melatonin, he used tamoxifen, really clever. The thing that blocks estrogen from your cells if you're female and got breast cancer. He used, some people say he used metformin, but there's not a lot of evidence. It's not in his book. But he also used Accutane. Okay, I'll go back a yard. I told you at the start, very high levels of stem cells in brain tumors. Accutane is an acne drug. Doctors don't like it.
Yes.
Because it causes liver problems. And it's why Care Oncology in London are using doxycycline. Both these 2 drugs can actually have effects on cancer stem cells. There is a third drug called niclosamide that can also have effects on these 2. My problem is Accutane actually does seem to have a problem with the liver, or give a problem with the liver. Doxycycline gives really big problems with the gut, and why? But niclosamide can be better. I'm not saying it is, I just say it can be better for some people. So horses for courses, to go back. He also used something called verapamil or something. It's a beta blocker. No, it's not. It's a calcium blocker. And if you're having drugs, the drugs can put your calcium up. So he was deliberately stopping that happening. He took supplements like PSK, Genistin, which is in red clover and soy. He ate lots of soy. What else? He did indole 3-carbon and whatever. He built a whole load of supplements around the outside, and he did his exercise and got his diet right. And the rest is history. He's 70 something now. He beat it.
Wow, that's pretty amazing. Are you in touch with him at all?
Pardon?
Have you spoken to him? Are you in touch with him at all?
No, I've never spoken. Fun enough, a name from my past spoke to him. It was Charlie Saatchi. No, Morris Saatchi. Morris's wife.
Well, his wife. Yes.
Morris's wife died, and Morris made a law, and he was trying to get off-label drugs to be allowed. He was basically saying there comes a point in everybody's life, if they are dying, when doctors should be able to use whatever they want. And he got him over as an example of this, but they changed governments. That was in the day when they used to change governments every 5 years, and now it's every 5 weeks, is it?
Every 3 months, I think we might find it. Yes, let's wait and see.
So that's he got him over. So I'd never talked to him. I've read his book and so on. But there's another thing people talk about. It's called CUSP9, CUSP9. A bunch of scientists ran an algorithm, or whatever you do, of all the off-label drugs to see what might make the biggest difference. They were scientists in Ulm in Sweden, and a chap in America who's formed, I don't know, the Brain Tumor Society or something. He was part of it, and they were going to do it. They were going to do clinical trials on brain tumors, and they were going to come out with results in 2020. I've never seen any results. So at the moment, it's just theory. It's just
okay.
What we tend to do is this. We tend to, I don't do it officially, but this is how I think. I've got kind of level 1, the circle. So we use the doctor's clever stuff, and we build a little program around that. Let's make the clever stuff work better. Hyperbaric oxygen, berberine, metformin, or something like that. And then we go out a yard and we say, okay, what off-label drugs would make these drugs work better? So mebendazole or Optune system or something like that. Okay. And then we go out another yard. And so I then say, okay, what supplements? And as you know, on our website, there's Amy's story. And you famously, I quote this a lot, you emailed me and said, can you name me supplements where there's research for brain tumors? And then you emailed me and said, congratulations, you have 20 out of 23. I bet you've forgotten this. I remember it. Ever the school teacher. No, you said, oh, you've got 20 out of 23. And yeah, we got research. It was Amy did 23, and I checked her other 3 out. And we've got research. We know, as I said, echinacea is really, really good with brain tumours. We know that the B vitamins, choline and inositol. We know fish oils are. We know turmeric is. We know boswellia is very good at reducing the swelling and so on. And so we got a number of supplements where they got quite a lot of research. And then we know it's the anti-estrogens, and PSK is from is it Coriolis or turkey tail? Turkey tail. And so PSK tends to be very good. So there are a number of things. So we might round the outside, depending on the patient, put a number of these supplements, and I might, if there's something in their background, I might give them more anti-estrogens, for example. So it depends on them. I build them a program. And then I'm sorry, it comes back to the simple things around the outside of that, which is exercise. Can you do exercise? You want to get your blood oxygen to 99 with or without the help of hyperbaric oxygen. You want to have your vitamin D at 125. Not just me that says that. Holic says that. America says you must be over 80. Holic and the Endocrine Society says you need to be between 100 and 150. So vitamin D3, I say 125. You need to keep your blood sugar down. We've talked about that. There is some research now on the fact that atorvastatin might work. I was always very wary of this because this is the other thing that people don't understand. You get breast cancer and your primary tumor feeds on sugar, but when it goes to spread, it goes into the lymph, and it starts to burn fat, and it needs lots of fat for all those new membranes. It needs lots of fat for to stick to blood supplies, and so off it goes around the body, fat, and so you need low fat. And so, Angus Dalgleish was giving people metformin and atorvastatin in 2008. So long before Care Oncology. And we've always really given people berberine and lycopene. But I'm not averse if someone's got a blood sugar level of 6, 7, berberine, get it down below 4. If someone's got a cholesterol level of 5, 6, get it down below 4. And a quick fix is atorvastatin. Another quick fix from your part of the world is these 2 professors, Taylor and Lean, who've been curing diabetes with severe fasting, and that will get you blood fat down and blood sugar down very, very quickly. And so suddenly, not to be outdone by all the other cancers, there were about 4 studies on brain tumors and atorvastatin about 2 years ago. So I haven't checked it out enough yet, but it doesn't feel to me like atorvastatin would work, because what happens in a brain tumor, you end up with like the stars at night. So you've got your primary and it goes down the nerve endings, and then you get a little star here, and then you get another little star there, and so on. That's why originally it was called an astrocytoma.
Yes.
But so that's what happens to you. And so there's that side to it. I am a little bit ambivalent about atorvastatin and cutting your blood fats. I tend to use lycopene because lycopene does other jobs, like it cuts glutaminase and stops glutamate being formed. We have other supplements we know have got research on brain tumors, like IP6. So IP6 has 20 years worth of research in America on breast cancer and prostate cancer, Maryland Medical School, Colorado Medical School. And then London, I think it was either King's or Imperial, did a study on IP6 with medulloblastoma in kids, and showed that IP6, which is totally natural from bran, robbed cancer cells of their iron and stopped them dividing, like at the 95% level. So I'm not saying it cures cancer, I'm just saying it holds cancer. But that's what I do. But go back to, I think, the kind of original question, what about immunotherapy? There's other immunotherapies about, and this is the big thing. So you got this dendritic cell study that was done, and it was done in 12 countries, led by America, although I think it's King's in London. I can't remember. I think it's King's in London who did it. And you've got people, it was called DC Vax. And the DC Vax people are going to come and build their factory in Britain. And you've got people 10, 12 years after the start of it still alive, kicking, because of the dendritic vaccine.
Why is more not known about this?
Pardon? I don't know. Because only I write about it. Who else writes about it in Britain? I'm not joking. Who else writes about it in Britain?
I mean, I've got to say, if we think back 20 years or more, when your slogan began, "Don't die of ignorance," your knowledge is so wide and so vast. I have to be, I'm so awed by it. But let's suppose somebody comes to you and they've just been diagnosed with a brain tumor, and they're obviously in shock, and they're obviously not taking a huge amount in. What are the first things you want to say to them to do?
Don't touch sugar.
Okay.
Fix your infections. Get your oxygen to 99, get your vitamin D to 125, cover the bases. I would get your blood sugar down to 4, take berberine, metformin, and just go with the flow. You're not going to argue with these guys. They want you to have the chemo, they want you to have the radio, you finish it, and then, as I said, they'll do the scans. Don't expect too much of the first lot of scans, because there'll be loads of radiotherapy damage around. They won't be able to see anything. So everybody's pinning their hopes on what's the first scan look like. But don't worry about it. Then they'll give you 6 months of chemotherapy. So I would go on the rainbow diet. I would read. It's all on our site. We were doing DC Vax with somebody, and he went to King's, and they said, we've knocked off, we're tired after doing the tests, we're waiting till the drug comes out. And so I happened to say there's a guy in Germany called Nesselhut, and lo and behold, the next day somebody with a brain tumor came to me and said, oh, Angus Dalglish recommended him. So I'm not working on my own. There are people who know about these people. The other thing is peptides, and there's some people called CGAT in Germany who are actually measuring you for peptides that work. So that would be my other big point. When you've just got cancer, we have lots of weaponry coming. We have lots of weaponry. I've got more weaponry than they have. I mean, you look at cannabis. Look at cannabis. So people seem to think cannabis will work with brain tumors. There's not a lot of research now, but what it does look like is 1-to-1. It needs to be 1 THC to 1 CBD. Well, there is a drug. It's called Sativex. And some oncologists in Britain prescribe it for people with brain tumors. And I had 3, I say little girls, I'm showing my age, they're probably all in their 20s and early 30s. And they were in Liverpool, and one of them was dying of a brain tumor. And they came to me and said, how do we get cannabis? And I said, believe it or not, you don't have to whisper. You don't have to, find a drug dealer. Go to your oncologist and tell him there's a thing called Sativex, and he can prescribe it for you. He'd have never even heard of it. So that takes you right back to the first point. Why is it all going wrong? It's all going wrong because I don't even know whether oncologists talk amongst themselves about what else you can do. So I would take the supplements, I would do the diet. I wouldn't necessarily take lots of supplements right at the outset. I would want, especially if you're methylating, to give temozolomide a chance. So,
but supplement it, not just the single drug.
You will never beat a brain tumor with temozolomide and radiotherapy. You've got to go outside that, and you've got to know what you're doing. And you probably know, I mean, we do PPs on brain tumors. They're not actually the biggest area we do PPs on, but what we do is we always try and get people in fast, so they know what to do when they have this or when they have that. That's quite important. But
so come to you early.
Oh, I'm not trying to sell myself in the slightest. I'm just,
I realize.
You've got at the outset, for the first, I don't know what it is, 10 months, they're going to be on this program. The issue is to make the drugs and radiotherapy work better. I would only use the flu supplements. When they go actually onto the chemo, I get people to come back to me and I say, okay, when are you having chemo? How are you doing it? And all right, what we're going to do is make this chemo work much, much better for a wider number of people. We're going to give you a real chance. to make it work for you. And that involves berberine and metformin and opportune systems or whatever. I don't know. I mean, it depends on the person. And we would build, we want people on the right diet at the start, but we would build a supplements program then.
Maybe you should write a book around this. It's really, really
important. Write a book on everything. Do you know what? Everything you need to know to help you beat cancer. I went to update it 2 years ago, and I realized I couldn't update it because when I'd written it in the first place 20 years ago, no one knew anything. And now everybody and their mum's got a website. Most of which is wrong. And so you get it a lot from America. I won't name names, but you get people talking about intermittent fasting, and it's not. It's time restricted fasting, which has completely different benefits. It's a weight loss program, really, rather than intermittent fasting, which is, you know, you produce a 2-in-1, which is a hugely powerful hormone that stops progression. So does the fact you're not going to eat for 5 days and things like this. It's never one thing. You build programs out of lots of things. But for me, if I had a brain tumor tomorrow, I would go out of my way to cut all my sugar, cut my blood sugar, and kill off the bugs in me.
Well, that's a very good start. Let us hope that you remain healthy in order to carry on doing this great work, Chris.
Yes. So can I retire soon, please? All right. We got
no.
This is just what to say. This is gonna be one show in a group where I'm attempting to run like 8 shows in eight days. Let's see if it happens. And if it does happen, we've got some very interesting people, not just me talking. So I hope it'll be really good.
It's a great start. Thank you very much for doing this, Chris.
It's my pleasure. I've just knocked the light over because I need to turn it all off. We're amateurs, people. You must have realized by now. All right. So, yeah, it's nice to see you again, Madeleine. We haven't talked for ages.
Well, it was a great pleasure, and I've loved writing for you and being a patron of Cancer Active for 21 years.
Should we tell people that your daughter has brain tumours?
Yes, but hers are benign, so it's somewhat different. We still need.
But you've lived with the problem as well, really, haven't you?
I have indeed, yes.
Benign ones do grow.
Yes, they grow and they cause a lot of damage as well. It's not just malignant ones that are an issue.
Yep.
But, you know, so we've learned an awful lot about diet and exercise. Far from perfect, but we're getting there. Mm. She's still running around. She's still working as a vet. She's still jumping her horses, and she's still running. So that's pretty good, isn't it, after 21 years?
I think one of the reasons Catherine lasted so long is she carried on scuba diving. She carried on snowboarding and things like that. That wasn't just a few pills we threw into her.
I think you've got to enjoy life and do the things you love.
Yeah. All right. Well, thank you for interviewing me. And I hope everybody enjoyed it, and there'll be more to come shortly. Okay. Bye.
Bye-bye.